Again this morning to answer your questions about the coronavirus and the pandemic is Dr. Kothary, the Chief Medical Officer for Dignity Health Central California Division. Good morning, Dr. Kothary. Thanks so much for joining us.
Well, good morning, Alex, for having me again.
Let's just talk a little bit about where we are here locally. We, again, continue to see not only the hospitalizations increase, but also our ICU rate increase as well. On top of that, of course, we're seeing a spike in cases. What is the most concerning thing that you see for us here at home?
You know, it is still concerning that we are increasing in our numbers currently. We do have a couple of good reasons why. We have, as you mentioned, the local skilled nursing facilities. We also have a local prison that's had a big outbreak. So, you know, a lot of those numbers are from those two facilities primarily.
What local prison is that? Do you know?
I don't know the exact name.
But there is a prison that is starting to see an outbreak in Kern County?
That is correct.
Can you, we have seen several states across the nation see a spike in cases. Now there's concern in a lot of the states in the South that are very concerned about not just the number of new cases, but hospitalizations. Are you concerned that California, Kern County, could be next?
You know, we have seen an increase in hospitalizations in general since the start of this pandemic. However, what we've seen is during the last few weeks, we've seen more people in the hospitals, but less in our ICUs. So I still feel very confident that this illness that's going on is weakening to some extent.
At what point do you think, if any, are we going to see the end of the first wave? And do you think that we will, in fact, see a second wave? Or do you think that we're going to kind of plateau with this first wave and then transition into a second?
You know, we should definitely see a decline in this first wave. And I would have expected that to happen already. But I feel like in the next few weeks, you'll see the numbers start to fall dramatically. And then we will have, you know, minimal or no cases for about a month, 2 months. And then we'll start seeing the surge come back again. A lot of people have said August. I don't believe it comes till October. And then I know someone mentioned, it was in the newspaper, that we're going to get a spike in February. I think we'll get one before February, though.
I want to talk about our local nursing facilities because we have been reporting on a significant number of cases and deaths in the county are attributed to our local nursing facilities. Is it safe to say that that is primarily where we're seeing all of these cases and a lot of these cases, a lot of these deaths? Or should we still, you know, as a public, be concerned about other areas of the county?
Well, I think we've definitely got to focus on our low-hanging fruit, which is the nursing facilities. But we've got to still focus on the population at risk, the elderly, the immunocompromised, make sure that they're safe as well.
I want to talk about masks. We have heard from, doctors for weeks and months now talking about the importance of wearing a mask to curb the spread of the virus. Now we're seeing the reason why it is so important. We're seeing in other parts of the country. There was a big story out of Florida showing that there was a large group of people that were at a bar and they were all inside the bar and no one was wearing a mask. And within the next few days, more than a dozen people had tested positive for the coronavirus, and now they regret not wearing a mask. What is your recommendation for people when it comes to wearing a mask? Because what I'm seeing right now is sometimes, and it is hard, as we go back to restaurants, for example, you wear a mask when you go in, well, you have to take it off when you go and you eat. But sometimes there are those reasons to take a mask off. What is your guidelines? What are your guidelines when it comes to wearing a mask?
Well, I'd say try and wear one as much as you can. But like you said, restaurants are hard to do. Bars are impossible. You know, you can't wear a mask in a bar. You have a cocktail in your hand or you have another beverage. And, you can't keep pulling it out and sipping on the beverage because every time you touch it, like we've talked about in the past, you infect the mask. So it is very difficult to wear masks in these situations. But when we can't, we've got to try and social distance, which is what we've been proven to show a decrease in the spread of these infections.
Does anything help when it comes to wearing a mask? We talk about how it's not good to wear a mask more than once because it could eventually, you can contaminate it. But if we run out of masks, or if we're looking for other items in our house or just available to us to make a mask, Do we need to be looking for specific material, or is anything that covers the mouth, anything that covers the face good enough?
For the most part, anything that covers the face. You don't want something that's too stretchy that will increase the size of the pores in the material. So you want, cotton, silk, stuff like that would be fine. You don't want anything like Lycra, something that would stretch too much. But CDC's even said you can just wear a scarf over your face.
Again, we have seen from current public health officials about the latest projections that they have, and they say that the ICU capacity could be reached late next month. Now, they stress it is a model, but the numbers that they have put in show that by July 28th, we could reach our ICU capacity. What are hospitals doing right now to prepare for that surge?
We're doing what we've done since the beginning of this pandemic, is we're working with all the other hospitals, not only in our community, but across the state, to identify issues at certain hospitals where they do have bed capacity issues, especially in the ICU. And we're talking about how to share resources, how to be able to transfer patients. If our ICUs are full and you have a couple extra beds, let's transfer these patients into a safe environment. So we're working together jointly in not only, like I said, not only in our state, but we have hospitals across the country in Dignity Health that we're working with as well.
There's been some news, big news, coming from the United Kingdom talking about a new drug or a drug that is actually helping people recover from the coronavirus, Dexamethasone. Can you talk a little bit about the encouraging news about from that study?
Yeah, so the study still has not been published. There was a study called the Recover study, and they used a dexamethasone, which is a steroid, and they used it in 6 milligrams, and they found that in the really sick people, especially the ones on the ventilators, they seem to do 30% better than not giving them the medication at all. Now, what we don't know is what else were they giving them besides dexamethasone? Were they giving them the plasma? Were they giving them remdesivir? We don't know all that information quite yet, but we do know this dexamethasone study is very encouraging, and we've already started in our hospitals to start using it.
All right, that is definitely some encouraging news. Dr. Kothary, thanks so much for joining us this morning. We'll see you next week.
Sounds good. Thank you so much, Alex.
All right.